You know the drill. We've got some questions going on. If you've got a question, please do chip in and ask away. Gone cold again. I've got an agenda, but always open to suggestions. I'm going to kick things off if that's okay. I'm not going to ask if everything's working because we're just going to assume that it is. Do we offer liposuction to the upper back bra line area? It's a bit of a funny specific question. I really should find out a little bit more history of these questions. Upper back bra line. Yeah, okay. So, I mean, basically, the thing about liposuction is you can do liposuction. It's working. Thanks, Corinne. Good to see you here this evening. Good to see you on your, I was going to say on your feet, but on your phone anyway. You can do liposuction anywhere. So yeah, can you do liposuction here, there, whatever? Yes, is the answer to that. The couple of things I would say about doing liposuction to the upper back bra line area is, first thing, when you're talking about doing liposuction to sort of bra lines, it's not uncommon for people to say, look, when I wear a bra, I've got this bulging bit over the top. And the problem comes if you've got a bulging bit when you're wearing a bra, then if you take the bra off, there's no bulging bit there. And sometimes it is the back of the bra is a bit too small. So the first thing with any surgery around your breast and things like that is to get a well-fitting bra is very important. Because if the back is too tight, then it can create this bulge, and that can be a source of unhappiness. It is difficult if when you haven't got a bra on, there isn't a bulge there, because when we do liposuction, we mark you and draw like gradient lines, like a mountain. But if you've got like a flat surface there, it's difficult to know how much liposuction to do, because we don't want to give you a dent when you're at rest. So if you haven't, if we give you a situation where you put a bra on and it bulges out, if we get rid of that bulge when you've got a bra on, you might take your bra off and have a dent, which obviously you're not going to be happy about. So you want it to look good out of a bra and in a bra. So there's a balance to be had there. So it's a sort of area that I would have a discussion about if someone wanted that. The other thing I would say about the upper back area, so people often want it around the front. If you want it around the back, then you run into your issues of positioning, because if it is, well, it's just in general terms difficult doing stuff to the back in general terms. So the reason being that if you're going to position someone, I guess the obvious place to position them is lying on their front, as if you're sort of sunbathing. But if you're under a general anesthetic, if you're asleep, the anaesthetists don't like doing the anesthetics in a prone, we call it a prone position. So prone position does carry a bit more potential for risks, a bit more difficult in managing your airway with the tube in your mouth and things like that. So it's a little bit more difficult managing you lying on your front in a prone position. It's easier to do it in a lateral position, but it's very hard to do both sides of your back in a lateral position. So what you sometimes do when you're operating, or I sometimes do, not you, when you're operating on a back, is you may do a lateral position and then turn to the other lateral position, but then you've got the complexity of turning people in theatre, which again, the anaesthetist doesn't like, because you're moving and you're potentially dislodging the airway again. And it's generally a little bit more work. So it is not straightforward doing liposuction to the back. However, it is a completely reasonable thing to do, and it is it's a definite thing that you can have done, but it's just you might think it's not as big a deal as it is. Well, it's not really a big a deal, but it's a bit of a thing. So it's if it is your back, that's the issue. Now this one, Amy's asked me this: do we offer hip dip filling? And do you know what I should have done? I should have Googled it before I came on, because I don't know. She asked me this the other day in the clinic, and I told her I didn't know what she was talking about. and she still put it on the Facebook Live. So do we offer hip dip filling? I'm going to say no. Hip dip filling. So I'm guessing I can kind of understand. I can guess what it is. So I mean, I've never met someone who's got a problem. I mean, unless you've had liposuction and you've got a dip, maybe. But if you just got a congenital, if you're born with a, if you're perhaps very slim and you've got a dip in your hip, sorry, I should have Googled it, but I don't know what it is, and therefore we don't do it. I'm guessing that if you're going to fill a dip in your hip, it's going to be fat grafting. So do fat grafting. So I guess if it was an abnormality, then yes, I would certainly consider fat grafting or filling a defect. If there is a defect in your body, I would definitely consider filling that defect, and fat grafting is a great way to fill defects. So on that front, yes, I would fill a dip in the hip. But on a cosmetic front, if you kind of have a normal figure and have a dip in your hip, you're probably sensing I'm probably not the guy to come to for a hip dip refill. Probably not your number one guy for hip dip filling. But yeah, good luck with that. Good luck with finding a hip dip surgeon. Can we remove a Bartholin calcified cyst? So a Bartholin, I think in previous ones I've said we can remove cysts anywhere. Just like a minute ago I said we can do liposuction anywhere. Probably someone's going to come up and say, what about this? And I'll probably say, oh no. And then you said it, you can remove it anywhere. So yeah, so I might have said we can remove cysts from anywhere, but a Bartholin cyst we probably would not remove. So a Bartholin cyst is a gynecological cyst. It's usually on the vulva, and it is not something that we would get involved with. Calcified cysts, that's unusual. Well, don't really get involved with them, so you don't see them very often. So maybe it's not unusual. Maybe it's completely normal, but certainly calcified cysts are unusual. But yeah, down in the genital area, we would tend not to get involved, and a Bartholin cyst would more appropriately be dealt with by a gynecologist. So that would be the right person for that job. I had a very early breast cancer in 2010 and had a lumpectomy and radiotherapy. Would I be suitable for a breast reduction? So short answer is yes, you would. It would be fine. But you're absolutely right to answer the question, because it is not straightforward when you've had something done to one breast. It's always difficult when you've got an asymmetry. When you've got an asymmetry, surgery often aims to balance that asymmetry. But when different things have happened to the different breasts, there's always a risk that there will still be asymmetry. And particularly in terms of the radiotherapy, the lumpectomy is not so bad. It's the radiotherapy that's the issue, because radiotherapy causes scarring kind of internally in the tissues of the breast. You can't really see it. It's not like scarring in the common sense of the word, where it's just like a line in the skin. It's like it's scarring of the tissues, and radiotherapy will therefore make the breast a little bit tighter, a little bit fuller. Actually, when people have had radiotherapy to one breast and not the other, it's a more pert breast, and sometimes people want the non radiotherapy breast to look like the radiotherapy breast, but the breast that hasn't had radiotherapy will always move a bit more easily, which is natural with the flow of the breast and the movement of the breast, but cosmetically it might sit lower. And so that's the main issue in the long term, that when you have a breast reduction, it's a lift is part of it, and the breast that's had the radiotherapy might well stay a bit higher than the breast that hasn't had the radiotherapy, which might droop a bit more easily, and that might give you a bit of an asymmetry. So that's something to bear in mind. There's not a lot you can do about that. If the natural breast is sort of drooping and sort of flowing more, you can't give that natural breast more, you can't make it tighter, sort of thing. You can't make it sit fuller. So it's a side effect of radiotherapy, which in a weird way, as I say, cosmetically, people sometimes prefer the side which has had the radiotherapy. The other issue with radiotherapy is in terms of the healing. Now, 2010 is a long time ago, but still there's an increased risk of wound healing problems in a breast that's been irradiated. So there'll be an increased risk of the wounds not healing up properly, which can be an issue with breast reduction because it has got that sort of T-shaped scar which can break down. So that's going to be an increased risk of breaking down of the wound in the short term, and in the long term, an increased risk of asymmetry with the reconstructed breasts, not reconstructed, the irradiated breast sitting a little bit higher than the non-irradiated breast. But the other thing I would say, it would depend on how your skin looks. So sometimes the radiotherapy can be quite aggressive and can give quite a lot of skin changes. So if you have skin changes and the skin itself actually looks scarred, then I might be thinking twice. But usually with radiotherapy, the skin kind of looks normal, but it's just got that feel of a bit more kind of woody, a bit more firm, but it looks completely normal. So I'm kind of assuming it's a normal looking skin. Here we go. What you got? I'll tell you what you got. I got this question here. I currently take Rivaroxaban, and as I suffer from blood clots, I have previously had 4 C-sections and suffered from blood clots, but then I went on to have bowel surgery, a hysterectomy, and a gastric band, and never suffered a blood clot during these procedures. Would I be suitable for a breast lift and a tummy tuck with liposuction? So yes, again, short answer is yes. Long answer is Rivaroxaban is a little bit of an issue with surgery, because Rivaroxaban is a blood thinner, which is obviously fantastic if you are suffering from blood clots. And to be honest with you, more problems come from blood clots than blood not clotting, if that makes sense. So if you're worried about someone, you'd be more worried about blood clot problems rather than bleeding problems. So that's the sort of spectrum. You've got bleeding on one hand, blood clots, too many blood clots on the other hand. So the Rivaroxaban is stopping the blood clots, because blood clots can cause problems with DVTs, clots in your legs, 5-inch lungs, PEs, and that's that can cause all sorts of problems and be quite serious. Whereas bleeding is obviously doesn't sound great, but it's actually not that bad. It's usually something that can be controlled and treated surgically, and is usually a sort of short-lived problem as opposed to blood clots, which can cause long-term problems. So as a general rule, we'd be more worried about blood clots than bleeding. But the issue with Rivaroxaban is it will increase your risk of bleeding. So if you're having surgery like a breast lift and a tummy tuck with liposuction, both of those have got quite a lot of cutting involved in them and quite a lot of raw surfaces. So therefore, big risk of bleeding. So Rivaroxaban would be an issue. So probably what we do is we talk to your doctor who's looking after you with your Rivaroxaban to see if we can stop your Rivaroxaban for a period of time prior to the surgery and then start it afterwards. And to see if that was safe to minimize your risk of bleeding from the surgery. If that wasn't safe, usually it is. Usually they're all right with it, but we probably have to say to you, you've got still a bit of a higher risk of bleeding because of the Rivaroxaban, but usually it's okay. If it's not okay, you can do, if you've really, really high risk of blood clots, then you can do things like heparin, which is a short-lived blood thinner. So you have heparin, which you then stop a few hours before the op. So then you've already got a few hours of not being covered for the blood clots. That was in someone who really needs to have not blood clotting, not have to have thin blood, which is usually, to me, you don't really see it anymore. It was people who had prosthetic heart valves. They had metal heart valves, and they worried that the blood would clot on the heart valve. So they absolutely needed to be anticoagulated. So those are the sorts of people you would be using heparin and just stopping it shortly before the op, and then doing the op, and then starting the heparin again, and then starting the blood thinner and waiting for it to get up to speed before stopping the heparin, and they needed to be in hospital for a few days because of that, because of the heparin, because the heparin was an infusion. But I don't think that happens anymore. I certainly haven't seen it, but I must say I don't treat many people who are on blood thinners. But I think it seems to be less of an issue. I think if you've prosthetic heart valve patients are not high on my target demographic for patients. I haven't got that many patients with a prosthetic heart valve, but nevertheless, as I say, Rivaroxaban and similar blood thinners like that, it is usually fine to do surgery with the rider that you might get you'll be in an increased risk of a bleeding problem. So you'd have to take that on board, that there is an increased risk of bleeding, and but as I say, that's usually something that can be dealt with relatively easy, as opposed to clots, which are a bit more difficult to deal with. I've just remembered I got a question on the little sticker on Instagram earlier, and I've just got another one here. So the one earlier was about hooded eyelids, and this one is about, so I'll do that one in a minute, but this one, I'm allergic to hyalase and want to have my lips dissolve. Is there anything else that can be used instead? Oh, God. I don't know. I'm sorry, I don't do lip fillers. I mean, hyalase is the normal thing. I've not heard of anything else being used to dissolve fillers. But I don't do fillers, so it's not my world. And the other thing I'd be, just to sort of devil's advocate, is like when you say you're allergic to hyalase, you've got to be a little bit, when people say they're allergic to stuff, when you look into it, you think actually they're not allergic to it. They had a rash or something like that, but then they had the rash for some other reason or something, or maybe it wasn't the hyalase. I don't know if hyalase is something that is a common thing that for people to be allergic to, but I guess I mean, as I say, you need to talk to someone who does lip fillers. So I'm on the edge of my ability here, but my advice would be, if you are allergic to hyalase, obviously avoid it. And if there is an alternative, fine. But if not, I mean, the filler does tend to dissolve unless it's causing issues. I mean, you can put a nick in and milk the filler out if you really need to have the filler removed, depending on how much of an issue it is. So it's like, I would seek the advice of an expert. And I'm sorry if you thought you were coming here to talk to one, but hyalase is not my bag. But yeah, good luck with that. Yes, it's me for the hooded eyelids. I'm going to arrange this tomorrow. Yeah, fairy dust. Yeah, hooded eyelids. Is it congenital or something? Because someone else. I remember the question, but thanks for the question. Yeah, I mean, to be fair, hooded eyelids is not. Yeah, sorry, Amber. Yeah, thanks for asking the question. Hooded eyelids is not. I don't think it's usually kind of a congenital thing, and that it runs in family. Although facial aesthetics is, hey Kelsey, good to see you. Facial aesthetics is a thing that runs in families in terms of how you look. You obviously look like your parents and your children look like you to a degree, but the specifics of a hooded eyelid is not. Is not, as far as I'm aware, something that runs in families. Again, I'm really sorry, I'm going to have to dodge, but to say that I'm not, I don't really do facial aesthetics. I'm really breast and body. That's all I really do. But yeah, the fact that your mum has them, it's quite a it's quite a common thing. Anyway, so I'm not sure if the fact that your mum's got hooded eyelids means it's something that runs in your family and necessarily that it's something you'll pass on. I think it's just something that is common in everybody, and I wouldn't particularly think that in itself is a reason for it to be running in families. It is something that can be treated relatively simply, treated, very effective, very dramatic changes you get when you have your hooded eyelids treated. It's called a blepharoplasty, and specifically with the upper eyelids, it'll be an upper blepharoplasty as opposed to a lower blepharoplasty, which would be doing the lower eyelids. Lower eyelids, a little bit more of a involved procedure than upper eyelids. Upper eyelids is literally tightening the skin of the upper eyelid to take away that hooded look. Really sorry, I don't do it. I don't, as I said, really do facial aesthetic surgery. We did have someone at the clinic who did upper eyelid blepharoplasties, but they don't do it. They're not there anymore. So we don't do the upper eyelid surgeries. So you'd need to look for someone else locally who does facial aesthetics for that sort of thing. But as I say, it is on paper relatively simple procedure to do, and with quite an effect, quite a dramatic effect to how you look and your general freshness of your face. So it's a really, in terms of facial aesthetic, it's probably the best benefit to downside operation you can have, an upper lid blepharoplasty. So that's it, folks. Thanks for that to Fairy Dust and Amber getting in there at the last minute. Corinne, Amy told me to mention tote bags, JJ. Don't shoot the messenger. Oh no, I was recommended too. Oh God. Corinne, are you saying that I should have got Amy a tote bag for Christmas? Now you've said it, I just remembered. Oh God. She did, yeah. Now you mention it, she did ask for that for Christmas. Yeah, thanks for pointing that out live on TV. Good God. Yes. I did forget that. Anyway, Corinne, next Christmas, I'll get it for Amy next Christmas. That will be something to look forward to, eh? Yeah, tote bag for Christmas. Thanks for reminding me. Yes, I think that's, yes. Hopefully she's not watching this and she'll forget about it. Yeah, when did she mention that? God, dear. I've got to write it down. Just got to write it down. Simple as that. Tote bag, Christmas 2023 for Amy. Nice one. Yeah. Very well, Kelsey. We are very well, and we are surviving the sub-zero temperatures. Hope you are too. And the flooding. Went to Worcester the other day. Crikey, the water's like. Today we had a chat. Oh, that's nice. Glad you did, Corinne. I'm glad you're okay, and I'm glad Amy and Vicky are keeping you going. Yeah, absolutely frightening in Worcester, I tell you. Banks burst. So yeah. Anyway, I am going to go and see what's going out in over there in the rest of the building, and I will be here 7 p.m. next week, and if you're there, I'll see you there. Amy isn't so happy now you've got her tote bag. Yeah, Kelsey, don't dwell on it, because Amy, I think, does watch this, although fortunately I don't think there's many. Thanks, Jackie. I think she watches on Facebook, and Facebook's a bit. I'm not sure it's working properly. That's what I tell myself anyway. It's not working properly. It's the only way to get through. You got to get through. Okay. So yes, nice one, Corinne. Thanks for bringing that up. And I do feel like a bad person for completely forgetting that. With Christmas, where are we? 17th of January. It's not that late, is it? A little bit of a belated Christmas present. Mind you, I've got to order it and stuff like that. It takes 6 weeks to come and stuff like that. Anyway, because it's one with a logo on, I think she wants. Okay, maybe I'll just get her an M&S one. Yeah, they do nice M&S ones, don't they? Okay, well, I will go and research the tote bag issue. Corinne, that's making it worse. If I mention it, I've got to then mention. Okay, I will do. Right, okay. I've got to mention that you mentioned it that reminded me live on TV that I've forgotten a Christmas present for my star pupil, Amy. I mean, they're all stars. Don't get me wrong. Amy is one of the stars. Got to be like, yeah. But she is a ledge. Okay, I will tell her, Corinne. So, without further ado, I'm going to stop the